and wellness. Being she's got your message. You came to get it from Karla's Korner. Make the world better, one life at a time. On Karla's Korner.
Hey everybody, it's Karla Jarvis, your favorite nurse practitioner, coming live from Karla's Korner. Yay! And I have my wonderful partner in crime. We're both Wonder Womans. Katie Johns, nurse practitioner extraordinaire. And we are so excited at Jarvis Family Medical Services to have her. So today I wanted you all to see her personality, for you all to understand where she's coming from. Because a lot of my patients, and they know who they are, they're like, all I want to see is Karla Jarvis. And sometimes your provider is busy and things come up, and we wanted to tell you all how we have developed a plan with each other. So Katie, tell me your background of your nursing history.
Okay, so I started out in the ICU. I worked in the ICU at Norton Women and Children's. So I have a lot of experience managing really complex conditions.
Yes, you do.
And the reason I left is because I really wanted to focus more on wellness, and that's what I love so much about it here, is the emphasis is on helping with illness, but really more so on wellness. So,
because we want to, too much in the world today is all about secondary care.
Absolutely.
It's not about prevention. And in a lot of countries, that's what it is for. And we need to get back to that in our country, is getting back to prevention. So we can teach them things to help them not have those medical conditions. It's better for everybody. It's better for the economy. It's better for your body. It's better for everybody, because then you're not sitting in the ER, which you're going to be there for 17 hours because they got to take the more complex case. So to you, you're complex because you're VIP, right?
Absolutely.
But to them, you don't have chest pain, you're not having a stroke, you're not having a heart attack, you're not bleeding from every orifice, you're not complex. But that's why you go to your primary care. So what we did was we developed this community practice. So we have Dr. Kenneth Krall coming in, cardiologist. He'll start on February 3rd. We have the licensed medical masseuse, which is Keela Shelton. So what we do is Katie and myself will sit down and we'll discuss the patients for the day. And regardless if I get pulled away for a business meeting or something to do with the practice, she can go into a room. She'll already know who you are. She'll already know the treatment plan that we came up with, and vice versa. If Katie sees you as a new patient or a reeval patient, you all develop a plan, then I'll may see you the next time, because we want to make sure that everybody here knows your name and everybody knows your medical conditions and can help you. We are all in it together. She is just as dedicated to health and wellness as I am. I mean, we look up not just medicines, we look up a lot of holistic things together. We learned about all of the minerals and electrolytes and amino acids that help with different things like magnesium, with glutathione. We really learned about MTHFR. Katie was like, what is this? And she was like, I keep hearing you say this. And what I love about her is she's not afraid to get in there and ask a question and then do the research herself. A lot of people in healthcare, unfortunately, think that once they make it to a certain level, they don't have to learn anymore. And you're not like that. Every day you go
learn
home.
from my patients every single day. And that's how I like it to be. I want it to be a collaboration where you're bringing your experience as the patient and what you've tried and what you've done and what you've researched. And then you can present those ideas to me, and we can come up with a game plan together.
But don't mistake us as being weak, you all. Now, sometimes some of you all, we got to just kind of give you a little loving, a little tap, like get on your medicines. Or, you know, so because we may have to start you out on the treatment plan, get you better, get the body back into homeostasis, which is balance, and then we can start taking things away. But we're the coaches, right? And they're the players, right? So you all have to also participate in your own healthcare. Sometimes people will sit back and be like, okay, Katie, heal me. I'm not going to do nothing you say, but I expect you to heal me. And we can't do that. We have to be responsible for our own self. How many times I went on a lifestyle change, and then by lunchtime I'm eating a donut.
We're like, Karla, get it together. Come on.
And the patients will say, did you just order you a Big Mac? Y'all got to pray for y'all provider. She needs help too.
I do.
So we are always working on each other. We're always looking for different ways. Like, we are so excited about this new practitioner program that we have.
Yes.
And the name is not like for a nurse practitioner. It's just the name of the company. And what it is we do a DNA swab. And instead of you having a cabinet full of ascorbic acids, what is another one? B complex, B12, magnesium, vitamin D. They'll tell you exactly what your body needs, and they'll make it for you in either powder form or they'll make it in a capsule form. So these are vitamins and nutrients that are designed just for you based on your DNA sample. We are 21st century medicine women.
Oh, absolutely.
We are going old school, right? High five. That's right. We are Ebony and Ivory. Bam, bam, bam of the healthcare world. Because we always look into different things. Like Katie loves skin.
Yes.
She loves dermatology. So our goal here is to really, really support that passion that she has. You know, she can look at you and tell if you need like a laser treatment. Because what was that you told me? Like, some people have, it's not necessarily skin cancer.
Right, it's precancerous lesions. So if you notice something dry and flaky on your skin that just kind of popped up out of nowhere, it's important that you bring it to our attention, because when we act on it quickly and we get rid of it, then it's nothing to worry about. They're called actinic keratoses, and they're those things that we ignore, and when we ignore stuff, that's when we get into trouble. So,
what made you love dermatology? You know, some people get wigged out with dermatology.
I think it's because it's a lot of the manifestations on the skin of what's going on internally.
Girl, you better repeat that again, Katie. I told y'all she was smart. Say it again, Katie.
So it's the manifestation of things that are going on internally that we're seeing on the outside. So when we're seeing those issues, you know, it might even be just dark circles under your eyes. You wake up and you're like, I just don't know what's going on. I just don't look like myself. And we look at those things and we're like, okay, maybe you need more hydration. Maybe we need more sleep. We all need some of that. But maybe, you know, we can add in good creams and all kinds of stuff just to help you feel better on the inside and on the outside.
Right, because we're about what? Mind, body, and soul.
Absolutely.
They all go together.
Yes.
So if you're thinking in your brain you don't look right or you don't feel right, and you just keep walking around, well, nobody's going to listen to you. We do listen to you here.
Yes.
And if it's something that we don't know or we cannot handle it, then we don't have any problem in doing referrals to people all around the city. We have other dermatologists we use.
Yeah.
We have other specialties like oncology, orthopedics, pain management, all kind of, if you are more complex of a cardiac nature, you know, you have several different layers of cardiovascular surgery. We have everything at our fingertips. We make sure we vet those people before you send them, because we want to make sure they treat you well like we do.
Yes.
We don't want our patients coming back.
Right, and we're going to help you navigate that system. Sometimes when you have so many things going on, you just feel like you get lost, kind of in the shuffle of everything, and you're trying to get referrals and make appointments, and those appointments conflict. So we will help you navigate making those appointments and getting there and managing those medicines.
And we're bringing in another person. Her name is Dana C. And that's what her business is.
Yeah.
She helps to navigate healthcare. So we give you a diagnosis of prostate cancer, right? And we say, all right, now we need to send you to first urology. All right, then what does that look like in the meantime? Are they going to do like 8 weeks of radiation, and you gotta go every single day? Okay, do you have a job? Is it transportation issues? What about nutrition? When we tell you on our test about the foods you don't process, some people don't process anything on that list. So then they're like, well, what do I eat? Grass? And I go, no, because you're allergic to grass too. So you can't eat grass. Right. Some people cannot eat wheat. No, you can't eat that because you're allergic to it too. And trees. Puff Puff Pass is a no-no too, because you can be allergic to marijuana. Yep. So that's what this person will really take the time with you to develop that plan for you. Okay, we're going to take one food away at a time and replace it, because you still have to feed the body. Right. You still need your nutrients. But that's what we're here for. We're just bringing in all different dynamics. Yes. And things get a little bit hard. That's what we have Keisha Brown for. She's our licensed therapist. So she come in, and she's not about any medicine. She's about strictly talking. Letting you have an objective ear for somebody to talk to help you kind of just devise how you're playing, or get your life together in order for you to be more successful in it. So that's what Katie and I are about. Yes. And then Katie, tell them something personal about you. Are you married?
I am married. I've been married for about 3.5 years.
What's your wonderful husband's name?
His name is David John.
Oh, David John. And my husband's name is Jonathan. You see how we got, and I'm Karla. So we K and K over here.
We have the same initials.
KJ, baby,
so
all day.
Made to be.
And then what I love about Katie is she's not afraid of anything or anybody. She just walks into a situation where I'm like, whoa, whoa, whoa. She's very calm and chill. And so we have the yin and yang to each other.
Definitely.
So if I start to get a little, she'll be like, okay, Karla, I got it. And if I need her to go, then she'll go, okay, Karla, I got it.
She brings me up, I bring her down a little.
Yeah. So that's how we are the perfect match. And we do that with the patients. We want to make sure the patients have the best of both worlds. Because if I get to talking too fast and I get so excited, Katie can explain it to you a little bit slower. So you'll be like, oh, now I get what Karla's saying. Because sometimes, they'll be like, you just talk so fast. What you say? You just told me a lot of stuff. But, and then what we love is on our spa side, integrating the two. So we had a person come in that complained about incontinence. And what you tell them, Katie?
Well, with incontinence, there's so much we can do. We've got an O shot, another alternative to taking just medicine after medicine, which really aren't good for it anyway.
Yeah, because it's going to end up drying you out.
Yeah.
So who wants to be dry and urinate on themselves?
Yeah,
their eyes are dry, their nose are dry, their mouth is dry. So that's why you don't really want those type of medicines to dry you up. And then what we did the knee. When we had the athlete come in and we put PRP in his knee, we have put it into the wrist.
We've done it with the hair. We can really do PRP anywhere. And we can get rid of wrinkles with it.
Yes. And remember when we had the lady with the lipoma? Oh, that was
way up my alley.
She was Dr. Pimple Popper of Louisville, Kentucky. This lady had a huge lipoma. Huge. She got in there. And then remember what Dr. Pimple Popper says, not just take out the insides, which was dead white cells. She took out the sac, cleaned it out, and then she closed it up, and that lady was so happy. I was like, you better go, Katie. She is the Pimple Popper lady. So we just love that.
Yeah.
And then she can look at a lot of things in a different way, being that she is fresh out of school. That is a different eyes than me being in this for a longer time.
Right.
So she comes with a fresher approach, and then coming from ICU, she's seen the bad part of when you don't take care of yourself. She said, what you said at one time, he was like, Karla, the people are coming in with hypertension uncontrolled, diabetes uncontrolled.
The problem, once you get to the hospital and into the ICU setting, is these things have been growing and manifesting for so long, and we haven't taken those preventative steps. So by the time they were coming to me in ICU, a lot of the damage was already done. And that's what we want to prevent. We want to help you get that game plan together so we can fix the problems when they're small problems, so we're not getting to the ICU. That's really the goal here.
Yeah. And what I do like is we do offer a free consultation. So if a patient comes in, because I've had plenty of patients come in and interview me first.
Yes.
Before they say, I don't know if I want you to be my primary care, because I always tell people doctors are like shoes. You got to find the perfect fit.
Right.
Now, if you have somebody that is willing to do alternatives because you're not convinced of doing Western medicine, we're your people. We'll try to do Eastern medicine as much as we can. Sometimes certain things we can't. If your A1C, meaning that you're diabetic, is like 8, 9, 10, 11, 12, 13, 14, we have got to get that down, because then you can have, blindness, you can lose a limb, that's affecting your heart and your kidney. So we have to work kind of fast. So we do have to use some medicines to bring down things. Some things with hypothyroidism, we may have to get them certain medicines for hypertension, but we try to incorporate that with finding out what foods they don't eat. We do a genetic test to find out what medicines they don't process. So we give you a copy so that you can have that, so that you can keep us and anybody taking care of you held responsible not to give you medicines that you don't process.
Absolutely.
So we sometimes do have to add in regular traditional medicine.
Right. And what I tell my patients when it comes to medicine, my approach is always, if I'm giving you a medicine, it's because the side effects of the disease process are worse than the side effects of the medication.
Amen.
So, and we can always talk about how do we come off of this medicine in the long run. So we're going to help you, if we give you a medicine, we're going to help you make the healthy lifestyle changes to hopefully eventually get off those medicines in the long run too. And
that's what we want to do. And even when we bring on more nurse practitioners, they're still going to learn the same community base. So if you all come in now, you'll see we have students, and my patients are very vocal. They'll tell us which students they like, who they don't like, who I should hire, who I shouldn't hire. I'm like, thank you very much for your input.